My question's to the Treasurer. The Mental Health Inquiry has received a significant volume of evidence from key stakeholders about the funding gap for mental health services. Mental health accounts for over 13% of the total burden of disease in New South Wales, but investment in mental health care is less than 7% of the state's total health budget. New South Wales invests the least per capita into mental health services compared to all other jurisdictions, and spending on specialised mental health services per capita has gone backwards since 2016-17. I acknowledge that it's the previous government that got us into this mess, but that it's now your responsibility to fix. This will require a significant level of investment to turn around, and peak mental health bodies are calling for new and innovative revenue streams. What budgetary measures are you considering to fully fund mental health services in New South Wales?
The Treasurer.
Well, firstly, can I just applaud the courage of the member in asking me a question? And may it serve as an inspiration for others as well, as we manage... I'll accept that interjection. I won't be holding my breath. That's true. I won't. But I do say that the doctor has asked a very important question. And I can inform the doctor that the New South Wales government is investing $2.7 billion in mental health services in 23-24. I'm asked about the specific measures that the government is contemplating or has already budgeted for, which I will just set out in our first budget some of the additional investment that we made. We went to the last election promising $6.5 million over 4 years to Lifeline. We've delivered it. We said that we'd provide $17.1 million over 4 years to support the Kids Helpline. We have delivered it in last year's budget. But we accept the point that the member is making, that the previous government has left us with quite the issues when it comes to mental health treatment in the New South Wales health system. Dare I say it's not just in mental health. As we saw yesterday with the release of the latest BHI data as well, the government is facing some pretty severe challenges in respect to emergency departments due to a decade of underinvestment in them. The fact that we've been able to allocate money to there to support an emergency department task force is one sign of how we are trying to free up capacity in the system to redirect resources to provide us in a better position to be able to invest more in mental health and elsewhere in the New South Wales health system. I'd also just point out that I well and truly accept the fact that mental health problems especially are affecting our young people, and that a lot of our young people are now presenting. And I have to say, the fact that we are establishing a culture of people seeking help is a good thing. And the fact that we are encouraging people to reach out is a good thing. The fact that heretofore we've had an element of bipartisanship on this is a good thing as well. Because if we are going to sustain a culture of supporting people's mental health throughout the entire time, it's important that it remains above politics. I'm for the debate about the better ways for us to respond. I'm for the debate about whether or not we can be doing a better job, whether or not there are better ideas that we can adopt. But the one thing that I do think we all have in common is we want to see a better result for the investments we're making, ultimately because that will help the people we're here to serve.